If your top blood pressure number keeps creeping up after 50, even when you feel calm, the easy explanation is stress, salt, or getting older. But there is a quieter explanation hiding inside the artery wall. Your arteries are supposed to stretch. Every heartbeat sends a pulse of blood forward, and healthy arteries absorb part of that force like a living spring. When that living spring begins to stiffen, the same heartbeat hits the wall harder. That is why aging can begin inside the arteries long before you feel old on the outside. You may still walk normally, speak normally, and feel mostly fine, while the pressure wave inside the body is already changing. This is the idea I want you to hold on to. Stiff arteries make the heart pay for every beat. The heart does not only push blood through pipes, it pushes blood through living tissue that can soften, stiffen, relax, inflame, calcify, and remember decades of pressure. Before we go deeper, one warning matters. Chest pressure, sudden weakness, trouble speaking, one-sided numbness, severe shortness of breath, fainting or sudden vision changes are not signs to study calmly at home. Those can be emergency symptoms, so get urgent medical help, and if you take blood pressure medication, do not stop it because of anything you hear here. The goal is understanding the machinery, not replacing your doctor. Now start with a simple picture. One tube is soft, elastic, and springy, while the other is hard, dry, and rigid. Push the same pulse of water through both. The soft tube expands and absorbs the pulse, while the rigid tube sends more force forward and backward. Your arteries are more complicated than a tube, but the principle is close. Elastic arteries, especially the aorta and large central arteries, are built to cushion each heartbeat. They stretch when the heart ejects blood, then recoil to keep blood moving while the heart relaxes. This is one reason blood flow is not supposed to be a violent on-off blast. The artery smooths the pulse. When arteries stiffen, the smoothing system weakens, and the top blood pressure number can rise because the artery cannot expand as easily. The heart has to eject blood into a less forgiving system. The pulse wave travels faster, and reflected waves can return earlier. That is why stiff arteries are not just a plumbing detail. They change the timing of the entire circulation. If this kind of explanation helps you understand your body more clearly, subscribe to Feynman's Body Code, and write your age and country in the comments, because vascular aging is not one country's problem. It is a human problem hiding in different lifestyles, foods, sleep patterns, stress patterns, and medical systems. The first hidden reason blood vessels get stiff is elastin damage. Elastin is the spring-like protein that helps large arteries stretch and recoil, but it does not renew itself quickly. Much of the elastic structure you rely on has to survive for decades, while every heartbeat and every pressure surge bends it again. Over time, elastic fibers can fragment, and when elastin loses its spring, the load shifts toward collagen. Collagen is useful, but it is stiffer. Think of elastin as the spring and collagen as the rope that prevents overstretching. You need both. But if the artery shifts from spring dominant to rope dominant, the wall becomes less forgiving. This is one of the deepest reasons arteries age. It is not only plaque blocking the inside, but the wall itself losing spring. The second hidden reason is collagen buildup and cross-linking. Collagen gives structure to the artery wall, but too much collagen, or collagen tied together too tightly, makes the vessel harder to stretch. Cross-linking is like tying extra knots inside the tissue. The wall can still exist, but it stops moving like young tissue. One driver of cross-linking is glycation, where sugar-related chemistry modifies long-lived proteins and makes them stiffer. This is where blood sugar and arteries meet. High glucose over time does not only affect energy, it can affect the texture of tissues. That is why diabetes and insulin resistance matter for vascular aging. The blood vessel is not separate from metabolism. The artery wall is listening to the chemistry of the blood every day. The third hidden reason is endothelial dysfunction. The endothelium is the thin inner lining of the blood vessel, and it is not just wallpaper. It senses blood flow, pressure, inflammation, glucose, smoking, exercise, sleep, and stress chemistry. When it works well, it helps produce nitric oxide, a signal that tells smooth muscle in the vessel wall to relax. That relaxation signal helps arteries stay responsive. When the endothelium becomes unhealthy, the vessel can become more constricted, inflamed, sticky, and reactive. Less nitric oxide means less ability to loosen, and more oxidative stress means the relaxing signal gets weaker. This is why the phrase, your vessels forgot how to relax, is close to the mechanism. A stiff artery is often not only structurally stiff, it can also be functionally stiff because the relaxation system is weaker. The fourth hidden reason is inflammation inside the vessel wall. Inflammation is not always a swollen ankle or a sore throat. It can be low-grade signaling inside tissues. In the artery wall, inflammatory signals can change how cells behave, encourage remodeling, increase oxidative stress, and weaken the endothelium. They can push smooth muscle cells toward a more rigid, repair-like state. Over years, this can turn the artery from a responsive living spring into a thicker, less flexible wall. This is why smoking, visceral fat, poor sleep, high blood pressure, high glucose, and inactivity do not only raise numbers. They change the environment the artery wall has to live in. The fifth hidden reason is calcification. Most people think of calcium as something for bones, but calcium can also deposit in the artery wall. When soft tissue starts taking on bone-like features, the pulse has less cushion. Calcification does not always mean the artery is blocked, but it can make the vessel wall less flexible. That can raise the workload on the heart, widen pulse pressure, and make the top number harder to control. The sixth hidden reason is smooth muscle behavior. Arteries contain smooth muscle cells that help control vessel diameter by tightening and relaxing. With age, pressure, inflammation, oxidative stress, and metabolic problems, those cells can change their behavior. They may become more growth-oriented, more inflammatory, or more calcification-prone. The vessel wall becomes less like a calm, responsive tube and more like tissue under chronic repair. That repair state can be useful after injury, but if it becomes the default, stiffness builds into the system. The seventh hidden reason is pressure itself. High blood pressure is not only the result of stiff arteries, it can also make arteries stiffer. Higher pressure stretches and stresses the wall. The wall remodels to tolerate the stress, and remodeling makes it thicker and stiffer. The stiffness makes pressure rise more easily, and the higher pressure continues the cycle. That is why I like the word loop more than the word cause. In the body, causes often chase each other in circles. Stiff arteries raise pressure, and high pressure stiffens arteries. If nobody interrupts the loop, the body starts treating the wrong state as normal. Now connect this to the numbers people actually see. The top number, systolic pressure, often rises with age because the heart is ejecting blood into a stiffer arterial tree. The bottom number, diastolic pressure, may stay the same or even fall later in life. When the gap between the two numbers becomes wider, that gap is called pulse pressure. A wider pulse pressure can be one clue that the arteries are losing elasticity. For example, 130/80 and 160/70 are not the same story. Both deserve attention, but the second has a much wider gap and can mean the pulse wave is hitting a stiffer system. Do not diagnose yourself from one reading, but do not ignore the pattern either. The cuff is not only showing pressure, it may be showing how much spring is left in the system. This is why arterial stiffness is so connected to aging. The arteries are upstream of everything. The brain depends on smooth flow. The kidneys depend on delicate filtration pressure, and the heart depends on afterload it can handle. The small vessels depend on the large arteries absorbing the shock. When large arteries stiffen, more pulsatile force can travel into smaller vessels. That can be hard on organs built for steady flow. This is one reason vascular aging is not only about heart attacks. It is about brain health, kidney strain, exercise tolerance, and the slow loss of reserve. The body may not scream, it may simply become less forgiving. The same stairs feel harder. The same walk raises pressure more. And the same poor night of sleep creates a stronger morning surge. The same salty meal lands in a less flexible system. That is how aging hides. Sometimes it begins as a reduced ability to buffer ordinary life. Now, what makes arteries stiffen faster? The first accelerator is uncontrolled blood pressure. Pressure is mechanical stress, and if the artery wall is exposed to high force day after day, it adapts. Some adaptation protects the wall in the short term, but long term it can mean thickness and stiffness. The second accelerator is poor blood sugar control. Glucose chemistry can contribute to glycation and tissue cross-linking, especially when it travels with insulin resistance, inflammation, triglycerides, belly fat, and fatty liver patterns. The third accelerator is smoking. Smoking damages the endothelium, increases oxidative stress, and makes vessels less able to behave normally. The fourth accelerator is inactivity. Arteries need flow, because regular movement creates shear stress across the endothelium. That flow signal helps the vessel remember how to relax. The fifth accelerator is poor sleep, especially sleep apnea. Repeated oxygen drops and stress surges at night can keep the nervous system and blood vessels under pressure. The sixth accelerator is chronic inflammation. It can come from visceral fat, poor metabolic health, smoking, untreated sleep problems, chronic infection, poor diet quality, or other medical conditions. The point is not to fear one factor, the point is to see the pattern. Arteries get stiff faster when the body keeps sending pressure, sugar, smoke, stress, and stillness signals. Now let us talk about what helps. The first lever is blood pressure control. Every day of better pressure is a day with less mechanical strain on the wall. That may mean medication, sodium changes, potassium-rich foods if appropriate, weight loss when needed, sleep treatment, less alcohol, and regular monitoring. Do not turn this into a purity contest. The artery does not care whether the help came from lifestyle or medication. It cares whether the force is lower. The second lever is movement. Aerobic exercise, such as walking, cycling, swimming, or any tolerable rhythmic movement, increases flow. Flow creates shear stress, and shear stress tells the endothelium there is a reason to stay responsive. This is why a walk is not just calorie burning. It is communication with the blood vessel lining. The third lever is strength training. Muscle is a glucose sink, and better muscle mass can help the body handle blood sugar more effectively. Strength training also helps maintain function, balance, and reserve as people age. The fourth lever is food quality. The artery wall responds better to a pattern rich in plants, fiber, minerals, unsaturated fats, and enough protein than to a pattern built from refined starch, sugar, and processed foods. The fifth lever is sleep. If sleep apnea is present, treating it can matter because night is when many people unknowingly stress their vessels for hours. The sixth lever is not smoking. For the endothelium, stopping smoke exposure is not a small cosmetic change. It changes the chemical weather inside the vessel. The seventh lever is measuring patterns, not moods. Many people say, "I feel fine," so the pressure must be fine. But arteries do not always announce stiffness with pain. You need readings, trends, lab markers, waist changes, exercise tolerance, and medical follow-up. One useful audit is to look at your blood pressure for 7 days, morning and evening, under consistent conditions. Do not use one rushed reading after coffee, pain, anger, or stares as your entire story. Look at the average. Look at the gap between the top and bottom numbers, and bring the pattern to a clinician. Another useful audit is movement tolerance. Can you climb the same stairs without unusual breathlessness, chest pressure, dizziness, or leg heaviness? If something changes suddenly, that is not a personality flaw, it is information. A third audit is morning pressure. Some people get a stronger morning surge because sleep, stress hormones, stiffness, and nervous system tone all meet at the same time. A fourth audit is recovery. After a walk or mild effort, does your system settle, or does it stay elevated longer than it used to? This does not diagnose arterial stiffness, but it tells you whether the system is flexible or stubborn. Now here is the part people often miss. Arteries do not stiffen from one bad meal or one stressful day. They stiffen from repeated signals that teach the wall to protect itself by becoming less flexible. The same is true in the other direction. You usually do not restore the system with one heroic day. You restore pressure on the wall by changing the signals it receives most often. Lower force, better flow, cleaner chemistry, better sleep, less smoke, and more muscle are not random health tips. They are messages to the artery wall. And if the wall receives different messages for long enough, the system may become easier to control. This is why I do not like the phrase just aging. Aging is real, but it is not one thing. Part of it is mechanical, part metabolic, part inflammatory, part behavioral, and part medical. The mistake is treating all of it as destiny. You cannot make a 70-year-old artery 20 again, but you can often reduce the load it has to survive tomorrow. You can reduce the pressure spikes, improve the flow signal, protect the endothelium, and stop feeding the loop. That is the practical meaning of vascular aging. Not panic, not denial, pattern recognition. If your pressure is rising, if the gap between numbers is widening, if exercise feels less forgiving, or if your doctor keeps mentioning vascular risk, Do not only ask what pill lowers the number. Ask what is making the artery wall less elastic. Ask what signals you send it every day. Ask where the loop can be interrupted. That is where the real work begins. The hidden reason blood vessels get stiff after 50 is not one villain. It is the slow loss of spring in a living wall. Elastin fragments, collagen tightens, nitric oxide fades, inflammation remodels, calcium hardens, smooth muscle changes, and pressure keeps the loop alive. That is why the top number climbs. That is why the same body can feel normal while the system becomes less flexible. And that is why aging starts inside your arteries. Because your arteries are where force, flow, chemistry, and time meet. If you protect that system, you're not just chasing a lower number. You're protecting the road that every organ depends on.